The following is a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
And welcome to the PinPoint Health Show. Dr. Lou is here. Anytime you want to reach out, you can do so. info@pinpointhealth.ca. And you want to go to the Lou Down. By the way, that is a long-form podcast series. If you haven't caught what Dr. Lou is doing as far as social media is concerned, including Facebook and Instagram and everything else, PinPoint Health is where you want to go. 1-855-55 Lou, DRLOU. Dr. Lou, it's good to be back at it again today. We have a guest, Dr. DeSantos, the practice leader for the Central Intake and Assessment Center for Low Back Pain for the Hamilton, Niagara, Haldeman, Brant Local Integrated Network. It's a mouthful, but it's a heck of a title. I'm going to let you take it away because you know a lot more about Dr. DeSantos and what we're talking about for the first half of the show anyway. How are you, fellas?
Hey, John, I'm doing well. Dr. DeSantos, how are you?
I'm doing well. Thanks, Dr. Lou, for inviting me on the show.
Awesome.
Yeah, of course. So one of the things that we speak a lot about on this show is low back pain. And so you're definitely a subject matter expert in that area. And before we get into that, I'll just sort of give a little bit of background for the listeners on Dr. DeSantos. So he's a chiropractic specialist. He holds fellowship status in the Canadian Chiropractic Specialty Colleges of Physical and Occupational Rehabilitation, and as well the College of Chiropractic Orthopedic Sciences. He also has advanced credential statusing with the Canadian Academy of Pain Management, and he's also a medical legal expert, and he's been doing that work since 1994, and we'll talk a little bit more about that in the later half of the show. But in the beginning, we really wanted to sort of focus in on low back pain and what is known as the rapid access clinics for low back pain in Ontario. I'm actually part of that program as well. I'm an advanced practice provider, so I'm someone in the community that, your family doctor might refer you to, and you might see me. And then what happens is if for whatever reason, I think, this low back pain case is potentially surgical or needs more specialty investigation, then I'll send it to someone like Dr. DeSantos. Now, the area I practice in is in Etobicoke, so it's not Dr. DeSantos that I would send it to, and Dr. DeSantos is in the Hamilton area, but it's the exact same program, just in the different regions. So, Doc, I'll turn it to you as the subject matter expert. Can you just give us, an overview of what this program really is and what it's designed to do?
So thanks, Dr. Lou. So this program was rolled out a couple of years ago, province-wide. It was piloted initially back in 2012 in Toronto, Hamilton, and Thunder Bay. And the whole goal of the program was to ensure that people with low back-related conditions are getting seen in a more timely manner, because back pain is such a prevalent condition. As you can imagine, the volumes of people with lower back conditions are significant for any family or primary care provider. So the whole goal was to get these patients seen in a more timely manner so that they're not waiting a year and a half to see a surgeon and then being told, that they're not a surgical candidate. So the goal was to get them seen in the right place at the right time by the right professional.
Yeah, and that's interesting. One of the things that we'll talk about often here, and when we have callers around this issue, a lot of people, when people will present sort of to their family doctor or a walk-in clinic with low back pain, and they may not be the best people to necessarily be dealing with that. And so when that's the case, those people will make a referral. And a lot of times that referral goes to a spine surgeon, which, as you said there, the vast majority of cases, I forget what the exact stat was, and maybe you know it, but I think off the top of my head, it was something like out of 100 people that go to a spine surgeon, probably 93 or 94 of them shouldn't even be there. And then the other ones probably should be there, and maybe one or two are actually surgical candidates. So it creates a massive amount of backlog for those that actually need what the surgeon is offering. And that was sort of where this all had its genesis out of, was that was realized that so many things didn't require a surgical consultation. Is that right?
That's correct. As you say, less than 10% of the people across the board with lower back conditions require, surgical intervention. There are some that are fall in a gray area that may require surgical consultation, but the ones that actually go on to surgical intervention are less than 10% for sure. And so the whole goal of this program was to ensure that those that aren't surgical candidates are getting seen in a timely manner, being provided with recommendations for appropriate evidence-based care and exercises and education, and those that are more serious or potentially have a surgical or specialist or need for specialist consultation are sent up to the practice lead in each area of the province, and then they're sent on for surgical consultation if they require it.
Now, you bring up something that I think is really important, and again, for the average listener, they may not necessarily know how to navigate this, and because low back pain is so prevalent, someone might be sitting there right now saying, okay, well, I've got low back pain. How do I know if this is something that I should, be very concerned about or not be so concerned about? What are sort of some tips that you will give people in terms of what to look for in terms of whether they may require more, specialty intervention or surgical consult, things like that?
Yeah, so for the program, there are inclusion and exclusion criteria. Most back pain self-resolves within several weeks. People have an episode of back pain. They might be quite painful for a few weeks, and then it resolves. So the inclusion criteria for the program, recognizing that many patients have self-resolving back pain, are symptoms more than 6 weeks or less than a year. So certainly if your back pain is persisting more than 6 weeks, you might want to talk to your primary care provider about being referred into the program, because that's one of the inclusion criteria. The other thing that people should be looking for is the presence of leg pain, if the leg pain is not getting any better. And then certainly if they've had an episode where they've got any sudden change in their bowel or bladder functioning, that's something that should be seen, immediately. But those are the main things that people should be on the lookout for.
Yeah, and that's really good advice. And what about in terms of, you said there, so more than 6 weeks, less than a year, are people who are outside of that year mark an ideal candidate for this program, or is there something else that they should be doing?
Yeah, so if somebody has symptoms for more than a year, they wouldn't automatically be excluded. If they have, for example, a history of back pain, and now they've developed leg pain as a result of their condition, then they would still be appropriate for the program. It's really the patients where that have symptoms for more than a year, but it hasn't changed. They may have had a history of back pain for 10 years. They're still able to work. They're still able to manage things. Those are the patients that would not be appropriate for inclusion within the program.
Right. And you keep bringing up leg pain, which, myself, I know why you're bringing it up, but can you just clarify for the listeners, maybe sort of a simple type of anatomy lesson? We're not going to take them through chiropractic college, but what is it that leg pain means? Why is that such an important symptom when it's associated with low back pain?
Well, leg pain can be, caused by many different, conditions, but the most common conditions that we see are disc protrusions or herniations, or some sort of stenotic process. Stenosis just means narrowing, so some sort of narrowing process in the spine that's causing leg pain, sometimes with walking or sometimes, just at rest. But of course, it needs the expertise of a professional to rule out whether it might be some other cause, such as a vascular cause or something else. But commonly, it's if it's stemming from the lower back, it's very commonly disc protrusion or herniation or some sort of narrowing process. Right. And with this program, so if someone is listening and they said, I think I might be an ideal candidate for this for referral to this program. I know, again, myself, because I'm part of the program, it's not as simple as going to any family doctor and saying, just refer me here. There's a process for the primary care professional that's involved. Can you take us through that a little bit? Yeah, there is a sign up, because the primary care professionals have to be knowledgeable about the program. But it's fairly simple. They just have to complete an online module which trains them on the inclusion and the exclusion criteria. So that's for primary care physicians as well as nurse practitioners. Right. One of the things that we try to really educate people on this show, and you'll be even more of an expert on this than me, but when it comes to low back pain, you sort of
earlier said that 10% of cases, or less than 10% of cases probably need some type of a surgical consultation or specialty intervention or whatever. But when we're dealing with the stuff that is outside of that, the 90% of low back pain, which is mechanical in nature, we're going to have to take a break in about a minute and a half or whatever. But can you start by taking us through what the right approach is for mechanical low back pain? So if someone's been told, no, this isn't an emergency, there's nothing more serious than this is a mechanical issue. And we get tons of callers all the time that have, are reliant on passive interventions. They're taking medication or they're getting massages constantly or whatever, and they're not really involving any active care into their plan. Can you start by taking us through how important it is for that type of back pain that people actually do that active care?
Yeah, the most important thing, of course, initially is to get a good diagnosis from the experts, and then after that, of course, exercise is very important. Or there are clinical guidelines that have been developed for back pain from different government and professional organizations, which are very good and they're evidence based. So following, getting treatment in accordance with those guidelines gives you the most optimal chance of improvement. There's a multitude of different treatments that are administered for back pain. Some have much more evidence than others for their efficacy.
Right.
We're talking to Dr. DeSantos here with Lou, Dr. Lou, and the Pinpoint Health Show. So much more to cover. This is a topic that affects so many people. Dr. Lou, it affects you and I, but there's so many people listening that need to tune in for the remainder of this show as we're focusing for the next little while on lower back and issues that pertain to that. So stick around. In the meantime, though, you want to reach out to Dr. Lou. Very simple, 1-855-55 Lou, DRLOU. You can email as well, info@pinpointhealth.ca. It's a Pinpoint Health Show. Continue. Stick around right here on Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
And welcome back, Pinpoint Health Show. Dr. Lou is here, Dr. DeSantos as well. We're focusing on lower back and things to be looking out for and educating over the next hour. Reaching out to Dr. Lou to carry forward is easy. 1-855-55 Dr. Lou, DRLOU, info@pinpointhealth.ca. And a reminder again, the Lou Down, the long form podcast series you want to look at and listen to at your leisure, and always check out social media and the postings going on with pinpointhealth.ca and Instagram and Facebook and so much more. Right back at it, Dr. Lou. Where do we leave off, right?
Yeah, so just for anybody that's tuning in, we have Dr. Dave DeSantos, who's a practice leader in the Central Intake and Assessment Centers for Lower Back Pain in the Hamilton, Niagara, Haldeman, Brant Local Health Integrated Network. Like you said, John, at the beginning of the show, it's a mouthful, but it's a very, very important role, that Dr. DeSantos plays in helping to manage people's low back pain. And I also alluded to that I'm part of the community setting with the advanced practice providers in this program. So we will see people with low back pain, and when we feel it's necessary and they need more investigation and potentially referral to surgeon, we will send them to the practice leads, of which Dr. DeSantos is one of those people. So, in the first part of the show, we were talking about all things related sort of to low back, and we sort of left off talking about the importance of active care. But Dr. DeSantos, one question that I will get a lot and I think would be important is, people have tried a lot of different treatments for their low back pain, and you sort of alluded to that there's a whole plethora of different types of interventions that you could do for the low back pain. And, some have very good evidence and some not so good evidence. But if someone is not responding to the treatment that they are, currently undergoing or have gone in the past, what approach do you take with that?
Yeah, well, I think it's important to realize that not everybody's going to respond, to an exercise program, for example. But the exercises are a very important component of the overall management of back pain in order to mitigate, recurrences of back pain. So it's important that the patient, as I mentioned earlier, get an appropriate diagnosis and and an investigation of what they've had specifically. There are clinical guidelines, like I mentioned, for the management of back pain. Things like manual therapy and exercises are recommended. Things like passive modalities are tended not to be recommended, but may be incorporated as part of an overall treatment schedule.
Right. One of the things that you brought up there is what I focus on a lot. In fact, one of the reasons why this is the PinPoint Health show and the PinPoint Health clinics is I'm a big believer, like you, in the right diagnosis. And John can attest to this. When people have called in and have questions, my first question to them usually, because someone might call in and say, I've got whatever disc herniation, and I'll say, well, how do you know that? And so many people self-diagnose and don't rely on experts to get the diagnosis. How important is it? Because, and I think this is an important thing to hammer home to the listeners, because I think it's one of the things that is really unfortunate that happens all too often. And it probably leads to a lot of the initial mismanagement of low back pain when people either are not getting the right diagnosis because they haven't gone anywhere, or they've seen someone who may not know all that much about low back pain and is just told the generic thing. Like the amount of people that have called in and said, I've got sciatica. I've been told that I have sciatica. And, you and I, Doc, will bang our heads at that, because it's like, well, that doesn't mean a lot if it doesn't come in the context of a specific diagnosis. How important is that component?
So you're right that in the fact that many of the patients don't have the diagnosis, but what's important to realize is that the diagnosis does not come from any diagnostic imaging. If they've had an X-ray or if they've had an MRI, just from that alone, you don't make a diagnosis. That's why there's an encouragement that the diagnosis comes from the physical examination, not the diagnostic imaging. And the diagnostic imaging only confirms what we suspect based on our clinical examination. And if there's something there that potentially is a surgical issue, then of course we'll send them on for surgical consultation. But the diagnosis comes from a very good clinical examination from a chiropractic or physiotherapist or medical expert. Yeah, and I'm so happy that you brought that up, because I say that all the time when people call in and they'll read, their clinical impression on their MRI or whatever it may be, and I try to hammer that home, where that is not the diagnosis. That's something that was seen on an image. But our job as practitioners and as clinicians is we've got to correlate that with what we see in the physical exam. And a lot of people, right or wrong, Doc, a lot of people might have on their MRIs, I see people all the time, and I'm sure you do as well, where they say, yeah, I had an MRI and so told me that I have a couple disc bulges at L4-5, L5-S1, yet you see them and clinically they have no findings of any disc problems, any radiculopathy, which means, problems with the nerve for those listening. How often do you see things like that, where people are coming in and relying, unfortunately, so much on the imaging for diagnosis and not necessarily what the expert who's doing the physical exam is telling them? Yeah, I see that often. It's not an uncommon thing where people would come in with a report of their MRI, and the MRI, the radiologist, to be thorough, will detail every single finding that they see on the MRI. So they might have a page or a page and a half of a lot of information that's there, but the information that's clinically relevant, that pertains to them, that might be appropriate for the surgeon, is only a small portion of that. So when we look at imaging, or when we look at the investigations that people have, we're trying to correlate it, like I said, to their clinical signs and symptoms, and whether they've got leg pain. And that's something that the surgeons are looking for, obviously, as well. So the imaging is really most important for the surgeon, because it helps them determine what they're going to be doing with the patient. And if it correlates with the person's leg pain that they're experiencing, and there's clinical findings to confirm that, yeah, there's a problem with a particular nerve, then those are the most important things. But the imaging is only a small part of it, and it's merely confirmatory to what you think is going on based on your clinical assessment. Right. And you're bringing up there things where surgeons will intervene. And there was one thing that you, on the last segment, you brought up bowel bladder symptoms. And I've talked about cauda equina syndrome before on this show. And although very, very rare, I do think it's important for people who have, severe acute low back pain with leg pain. It's important for them to note. And
unfortunately, the reality is a lot of times their practitioners don't make them aware of this. But can you take us through what cauda equina is, the symptoms that are sort of prevalent with it, and why people need to be aware of that, and why it is an emergency?
So the nerves that stem from the lower back area that supply our lower extremities, some of those nerves also supply our bowel and bladder function. So when somebody has a very large disc herniation, for example, there are instances where it can result in a cauda equina syndrome. It is very rare. It's one in thousands of cases, but it's something that has to be seen immediately. So some of the signs and symptoms that people may have are any sudden change in their bowel or bladder. And the most predictive is if the person cannot empty their bladder. That would be one of the most concerning things. And then, of course, with that, we're always looking for whether the person has any numbness around their bottom area or in their saddle area between their thighs. If there's any sort of progression of that sort of thing, or any weakness in their legs, then that's something that we want the person to be seen as soon as possible.
Yeah, and clinically, like I know when you're using all those terms, people are often confused, but I know clinically what I often will ask people is, when you're wiping yourself after having used the washroom, can you feel that? And that sort of hits it home for people to sort of make it, oh, okay, yeah, I get what you're sort of saying, because, again, for you and I, Doc, we sort of know the medical lingo and we understand, but, it's a very, very important thing for people to keep an eye out for, and like you said, very rare, but nonetheless an important thing to be aware of. Going back, so that's sort of the most extreme case. But again, we know that the vast majority of low back pain cases are not those extreme cases, and often require not much more than conservative management. And we were talking about exercises. And, there's a bunch, the same way there's a lot of interventions for low back pain, there's a ton of different exercises out there. What are some of your go-to exercises, I guess, for the management of low back pain?
So, as you said, there's a number of different exercise approaches, but the main thing is doing exercises to try and condition the lower back in order to prevent future recurrences of lower back pain. If somebody has leg pain, then one of the things that we're commonly recommending is what we call direction-preferred exercises, where we move the spine in a particular direction in order to get try to get the pain away from the leg towards the lower back. If we can get the leg pain improved, then the person is less likely to be a surgical candidate. And so that's the primary goal. And then, of course, many people have heard the term core conditioning, and that's an important part of it, as well as the general flexibility and stretching routine for many individuals. And it's not just the back, of course. We're talking about the hamstring musculature, the thigh musculature, which can affect the biomechanics of the lower back and the pelvis. So those are important areas as well that we tend to focus on.
Yeah, and it's incredible clinically how many people I've seen that have are coming in with low back pain, or they've had a history of low back pain. And something that I've heard a lot of times is, and people will naturally sort of say this stuff themselves, right? And they sort of, and you don't even have to really push them all that much. And they'll sort of, offer up that, hey, when I used to be more active, I was able to, manage my low back pain. People go through ups and downs with their activity levels. And a lot of people that have these chronic issues have said to me, I found that when I'm really active and I'm, paying attention to my health more and, getting into the gym or exercising or whatever it may be, I'm overall much better. And I sort of sit there saying, well, you sort of know what you have to do then. And it's just sort of the push that's required to get them back on track with doing those exercises. But I think it's something that is very much undervalued, is the importance of the activities that they need to do. And unfortunately, as we were sort of saying before, so many of the people that we see in the culture that we live in nowadays, people want the easiest solution possible for their low back pain. And the reality is that the rehab program is actually difficult, because it requires you to be doing something, every day, potentially multiple times every day. Management of your own low back pain, correct me if I'm wrong, Doc, isn't just about the exercises, but it's also about, doing the right things that you should do and avoiding the wrong things that you shouldn't do. And how much time do you spend educating people on things to avoid, for example?
That's a very important part of the overall interaction with the patient is the educational component, because many patients may not be aware of some of the things that are potentially exacerbating their back pain. So that's an important, very important component, as well as instructing them on exercises.
Right. Yeah. Exercises are such an important thing, and so many times, you brought up stenosis, and it's funny. I've had people, oftentimes, and we know that stenosis is a presentation that happens most often in the elderly, and one of the things that, will happen with that is people start to get that stooped forward posture naturally, because their body is trying to offload the pressure on the nerves, and it's funny. A lot of the times I've had a husband and wife combo come in, and it's the man that has stenosis, and the wife will say, I've been telling him to stand up straight and force himself to walk, and those are sort of, again, the wrong things. And as soon as you can provide some level of education, like you're saying, in terms of, no, hang on a sec, like if you understand why his body's doing that, you'll actually, he's not doing it on purpose. He's doing it, well, he is in a way, but his body is doing it on purpose to actually protect him. And so, trying to force him to straighten up or walk longer is actually probably going to make him worse. And they sort of, will sit there, and then, it's funny because they're often like bickering at one another at that point. But anyways, the point is that the education component is something that I focus on a lot, and is really, really important with low back pain, because if you know what you should do and you know what you should avoid, that can help a tremendous amount.
Guys, let's take a short break here. Lots more to cover. Dr. Dave DeSantos is joining us here on the PinPoint Health Show. We're all focusing and talking about lower back and lower back pain. So if not yourself, you probably know someone that's affected by this. So stick around for the remainder of the show. Reaching out afterwards as well, 1-855-55 Lou, DRLOU, and info@pinpointhealth.ca. It's the PinPoint Health Show. This is Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
And welcome back to the PinPoint Health Show with Dr. Lou, 1-855-55 Lou, DRLOU. After the show, to reach out anytime, have a chat, a consultation, move forward with it. And a reminder, the clinics are open and running. You shouldn't hesitate to reach out to Dr. Lou, info@pinpointhealth.ca as well. Dr. DeSantos continues on with us here, our chat and our conversation about lower back pain. Last segment, Dr. DeSantos, you mentioned cauda equina and why that needs immediate attention. Expand on that. Why is, it's a very rare condition, but why does someone have to read or should seek reasonably quick medical attention if they think that might be the problem?
Yeah, so as I mentioned, cauda equina is probably the most serious thing that we see, and the thing that we're looking out for with patients that come in with lower back conditions. I just wanted to say that it is a very rare condition, so I don't want anybody to think that if they just have a little bit of constipation or some other issue that it's necessarily a medical concern. So the things that we're looking for with people that have lower back condition is a sudden change in their bowel and bladder functioning. And that usually is something where they can't empty their bladder, and they have associated numbness in their saddle area or around their bottom area. And so the nerves that supply our lower extremities from the lower back, there's different nerves that also supply our bowel and our bladder. And the main concern that we have is we don't want any you can have symptoms coming from a compression or irritation of a nerve, but the nerve may still be functioning well. But what we don't want is any permanent damage to those nerves. So that's why we're always concerned about people that might be developing some of these signs and symptoms.
Yeah, and again, very, very rare, but nonetheless important for people to be aware of. And if you're concerned with those things, do seek immediate medical attention. But shifting gears here from the rapid access clinics, one of the other aspects that Dr. DeSantos is an expert in is in the medical legal world. And we've discussed, car accidents, disability claims, and other forms of injuries like that on this show previously. And I think having an expert like Dr. DeSantos can also help navigate this world. And so, Dr. DeSantos has been a medical legal expert since 1994. and he's provided expert assessments regarding things like catastrophic impairment, medical and rehabilitation, and other disability benefit issues. So, Dave, sort of going into very high level, but I'll turn it to you in terms of the medical legal world. Someone hurt in something like a car accident, what is it that they should be doing? Because there's going to be a lot to navigate when they're there.
Yeah, so the first thing I would say is that, ensure that you get appropriate care and rehab as early as possible, so that you avoid the potential for developing any chronic symptoms. Because the most important thing, of course, is getting better. But having said that, if there is an ongoing dispute with regard to medical rehab benefits or disability benefits, the rules have changed over the years, and now there's no requirement that the insurer have a medical assessment. In the past, the rules required that before an insurance company could deny a medical or rehab benefit, that they had an independent medical or healthcare assessment. And now the rules have been changed to they may require a medical assessment. So it's important to have that in the back of your mind, and that having access to a medical expert is not guaranteed. So working with your lawyer is important to ensure that you get the appropriate expert assessment that you require is important.
That's a really important thing that I think you bring up there, because a lot of the times when I see people, again, clinically, and if they've been hurt in something like a car accident, I will recommend that they should get a lawyer, and there's a lot of them out there. If they ask me for a referral, I'll give usually a number of referrals. But a lot of the times people will ask me, well, why do I even need a lawyer? And I think what you brought up there is really important. Can you just reiterate that again for the listeners? Because I don't want it to go missed, and I think that's an important thing why people need to be aware that there's not necessarily like you said, an entitlement to that, and really they might need someone on their behalf to sort of fight for them.
Yeah, so if we're looking at different areas of injury, for example, with WSIB, if it's a work-related injury, they have their own assessment program, and if you're injured and there's an ongoing dispute as to whether or not you require care or would benefit from treatment, then there is an assessment process through that. Through the Workers' Workplace Safety and Insurance Board. With auto insurance, like I mentioned, the rules have been changed over the years. In the past, the insurance companies could not deny a benefit without having an independent assessment, and now the rules have been changed to, and they were changed a number of years ago, but it states that they may require an assessment. So there's no guarantee that the person is automatically going to get an expert assessment. If there's questions about their need for ongoing treatment.
Right. And when you've been called upon for your expert assessment, can you take us through sort of what it is that you do in order to provide that expert assessment?
Well, the main thing is that first off, I just wanted to say that I work with both plaintiff and defense lawyers. And the main thing is if the person is seeking a independent assessment, is that they ensure that the person that's doing the assessment has the expertise to assess them. One of the things that I've always advocated for is a professional peer review assessment. So if somebody's going for physical therapy, for example, they want to see a physical therapy expert. That's the best way of ensuring that they get a thorough assessment if there's dispute about whether the person would benefit from ongoing physical therapy.
Guys, let's take a short break. Lots more of Dr. DeSantos on the way, and reaching out to Dr. Lou, really simple. As I mentioned, 1-855-55-Dr. Lou, DRLOU. Keep that number, write it down, and use it. info@pinpointhealth.ca is the simple email address to get a hold of Dr. Lou, one of his very capable team, and search out help. Get to one of the clinics as well, and the Lou Down is a long-form podcast. That is how we got social media covered, as well as Instagram and Facebook and everything else. So we'll continue after a short break. More of the Pinpoint Health Show is on the way. This is Global News Radio.
You are listening to a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.
All right, welcome back. PinPoint Health Show here with Dr. Lou and our guest this week, Dr. Dave DeSantos, talking about lower back and everything encircling that particular topic. You want to reach out anytime, 1-855-55-Dr. Lou. That's DRLOU, and info@pinpointhealth.ca. Dr. Lou, you got about 9 minutes to go for today's show. Take it away, pal.
Sure, and again, we have Dr. Dave DeSantos here, and we started off talking about the rapid access clinics for low back pain, and we shifted gears towards the medical legal world since Dr. DeSantos is also an expert in that world. One of the things, if anybody's involved in something like WSIB or a car accident disability claim, especially on the car accident world, you might have heard things like the catastrophic impairment. Doc, can you take us through what that all means to somebody and sort of how someone is deemed catastrophic?
Yeah, so with auto insurance, there's different levels of benefits that people have access to, and obviously the government recognizes that those that have sustained catastrophic injuries have to have sufficient benefits for their treatment, because it's much more serious. So there's specific rules and criteria as to who may have deemed had sustained a catastrophic impairment, for example, and under the rules, the person has to have sustained a 55% what we call a whole person impairment. So that's kind of the threshold as to whether or not somebody has sustained a catastrophic impairment, and that's a combination of physical and perhaps psychological issues combined, or it could be just strictly a physical issue if the person has had a amputation or something like that of an arm or a leg.
Yeah, and I think that the physical stuff is obviously a lot of the times a lot easier to assess because it's apparently more evident. On the psychological side, that could be more of a challenge, and so there's experts that deal in that world. We don't have too much more time to go through a bunch of different things, but can you tell us a little bit about the different types of disability benefits that are sort of out there?
Yeah, so with disability, of course, somebody could be a caregiver, they could be a homemaker, they could be disabled from their work. So there's different classes of whether somebody has sustained an impairment that deems them disabled from whatever they were doing prior to the accident. So there is different criteria. Obviously, the most common one, or the one that people think of mostly, is whether somebody has been disabled from work. And so there's, there are assessments that are performed for that category of individual who has sustained a motor vehicle accident.
Yeah, and there's lots of levels there. And again, this is a very, very complicated world. But I guess sort of the summary of it is, people should, I guess, seek the right medical experts, the right legal experts when they have these things. And neither of us are lawyers, so we won't talk about the legal stuff. But on the medical expert side, how does someone know if they're seeing, how do I put this? How does someone know if someone's seeing sort of the right people versus the wrong people? I know I've talked about some things in terms of red flags on certain types of people that you may not want to see from a medical side, but is there advice that you give on who might be the right or wrong medical professional to see for these types of issues?
Yeah, what I would recommend is before somebody attends for an assessment, whether it's requested on behalf of the insurer or somebody else, is that they seek the qualifications of that individual. The other thing that people want to be looking for is that the person spends time with them. If the person just goes in and it's a 10-minute assessment, well, you can't do an assessment in that and look at all the issues, especially with this complex world of disability or medical rehab benefits. So that's an important thing to look for as well, is that the person's spending time, being very thorough with them. As I mentioned, the qualifications of the individual are very important. And you may want to request that an expert peer review assessment be performed if there's a dispute. For example, if there's a dispute, as I mentioned before, about physical therapy, you could request that you see an expert physical therapist or chiropractic specialist or chiropractor, to evaluate the benefits that are in dispute.
Any big takeaway points that you'd really like for people to sort of remember if they can? Yeah,
what I would say is that don't necessarily rely on the opinion of one individual. Do your homework. Take responsibility for your own care. Make sure you're exercising regularly and trying to get better. Those are the main things that I think has to be people have to adopt if they've been injured, whether it's in a car accident or any other capacity.
Yeah, and I think that sort of is a nice summary not only of this show, but a lot of the things that I've tried to do on this show over the last, I don't know, 5 years or whatever it's been, John, that we've been doing this show. Yeah. You're saying the same things that I've constantly said, which is, get the right diagnosis. Once you have the right diagnosis, manage that in the best evidence-informed way, and that includes a lot of different things. And if you do that, you can oftentimes prevent things from becoming overly chronic. You and I, Dr. DeSantos, have both seen people who unfortunately have let things spiral so much out of control, sometimes through their own fault, sometimes not through their own fault, but nonetheless the result becomes that chronic nature, which can be a lot more devastating in terms of impact on life and quality of life and things like that. And if you can deal with things in the acute phase, that's always a better option than letting things go on for too long. And like I said, sometimes it's not even the fault of the individual. Sometimes it's a lot of times the advice that they've gotten. The amount of times that John and I have had people call in for things like, it's crazy. We've had people call in who have had surgery and then they're not doing well, and it was, say a knee replacement, and then I'll say, have you done rehab? And they'll say, well, no one recommended for me to do rehab. Yeah. And so that's pretty crazy that those things sort of still happen, which sort of goes to the point that you made. Don't be afraid to get another opinion, to try to get a second opinion. You don't want to have 10 opinions, because if 10 people are telling you the same thing, you border on maybe being a bit of a hypochondriac. But 2-3 opinions, I know that I've recommended it for my patients. I have no problems with someone seeking a second opinion, and I don't think any other professional should. And unfortunately, there are some that may have an issue with that. Is that something that you find as well clinically, that people want to encourage their patients not to have a second opinion?
Yeah, no, I think most responsible, anybody that's reasonable and responsible would encourage a second opinion. I even encourage it with patients if they have outstanding questions. I try and address all their questions, but I think it's entirely within the right of the patient, and it's entirely appropriate if there's any outstanding questions that have to be answered, that the person seek another opinion. Like you say, you may not want to get 10 opinions, but certainly a couple of opinions, 2 or 3 opinions, when it's something that's perhaps a little bit more complex, is entirely reasonable.
Yeah. Guys, another fantastic show. Dr. Lou, you want to just wrap it up with your final comments, and we'll call it a week for sure. What do you think?
Yeah, absolutely. And, again, Dr. DeSantos, thanks very much for being with us here today and providing all the valuable insight that you have to our listeners. Thanks for having me, Dr. Lou.
You want to reach out anytime now that we are done, or listen back to the show, that is available for you as well. The phone number, 1-855-55-Dr. Lou, DRLOU. You probably have that written down by now. Online, you can go to the Lou Down. That's the long-form podcast, and all the PinPoint Health social as well, and Facebook and Instagram and all those things as well. You can reach out through email, info@pinpointhealth.ca as well, info@pinpointhealth.ca. Thank you again, Dr. Santos, and we'll catch you next time on the PinPoint Health Show right here on Global News Radio.
The preceding was a paid commercial program. Unless otherwise identified, the guests on the program are employees of or otherwise represent the advertiser. The opinions expressed therein are those of the advertiser and do not necessarily reflect the views and policies of Global News Radio 640 Toronto.